I'm Dr. Martin Velez. I'm an oral surgeon. I practice in Roswell and Alpharetta. I graduated dental school in 1989 from the University of Texas Health Science Center in Houston. I then followed a general practice residency in New York City, where I established an experience with oral surgeons and soon led me to a want to follow oral surgery as a career. Aside from being a general dentist, following several years afterwards, I wanted to pursue oral surgery as a career, which then I pursued as an oral surgeon in the military. I actually served in the military as a general dentist for several years, as they do require, and I did my training at Dwight D. Eisenhower Army Medical Center and graduated in 2001 as an oral surgeon. I realized I wanted to be an oral surgeon. It's my experience in New York City with the trauma and pathology that one sees in inner city hospitals was a valuable experience for me. It's then that I kind of realized I wanted to follow that career path. In undergraduate and graduate school, you really don't see that, but once you start into a hospital environment, you see all the environment that's involved with oral maxillofacial surgery. I then pursued it with the military, which is an invaluable experience that I, receiving the military training in a hospital setting, but also in a field setting in a combat support hospital that I've served on several occasions. There's an invaluable amount of experience that one receives from that alone. What keeps patients coming back to our office, in my Alpharetta office and my Roswell office, I really do pride that I treat them as a gentleman, I treat them as a person, I listen to them, I really care what they have to say to me, and then we talk, we get to know each other. I think people appreciate my listening, but I understand, there's an anxiety coming to a surgeon's office. Our staff, a dynamic group of people that from the front desk to the office staff and to the doctors, we want to treat you with professionalism. Understand that you are our family member as you walk in our office. I want all my patients to know that when you come see me, I'm on your side. I try to speak to you as a person, not necessarily always a patient. I want to educate you and help you through and guide you. I'm not going to make a decision for you, but I'm going to make you a smart patient so that you can make your own decisions. I pride myself in you being to feel comfortable, to feel at ease, and to remove the anxiety that one sometimes comes with to an oral surgery office. We have the best technology. We have a dynamic group of people that work here, from the doctors to the staff to the equipment we use. We use the most modern techniques, ideas, medicines. We have a vast array of knowledge from people that are just recently out of residency for the latest equipment and techniques to the patient, doctors and staff that have been doing this, almost nearly 30 years.